issue again and again. And as thrilling, I recognize the first challenge is to get Senator Obama elected, but I do feel that they don't go far enough with their policy. As I said, we're in favor of a single payer, and I think that any plan that leaves the insurance industry in place is deeply flawed and doomed for failure. One of the things with what happened in Massachusetts, now they have seen a decrease in the number of uninsured. We project that they probably had 700,000 people uninsured in Massachusetts, and it's probably down to about 350,000. So a big cut in that. But how did they get there? They got there by massive expansion of public programs. And the numbers released by the census on Tuesday showed that we have 45.7 million people uninsured now in the United States. Now, that's in 2007.
Right.
It was 2007 numbers, and we were previously at 47 million. So how did we get this decrease? Across the country, there were massive expansions of public programs to try to enroll people in S-CHIP, which is what you referred to, which is the Children's Health Insurance Program.
Right.
The state Children's Health Insurance Program. The problem with that and the problem with those numbers is that they do not reflect what began near the end of 2007, which was an economic downturn, and that we suspect the numbers will be much worse next year for 2008. One, because there is a further deterioration in the employer-sponsored health insurance, and were it not for this massive expansion, we think that about 2.4 more million or 2.7 more million people were insured as a result of public programs, then actually the number of uninsured would have gone up because there were another 1.4 million who were uninsured or who lost their employer-based programs. So we're seeing, and as we see this economic downturn, the states are going to have less funds available to try to expand coverage this way. But if the success of the past year, if you can call it that, if going from 2006 and 2007, we saw a decrease in the number of uninsured. We saw them by expansion of public programs. When are we going to accept that the private insurance industry is not going to solve this problem for us? And what decreases the number of uninsured is public programming and public funding. And as long as the private insurance industry, which has this really conflict of interest, they have to make profits, and when they make profits, in order to make profits, they have to deliver less care. You can't expect that any expansion of benefits that requires the insurance industry to deliver it is going to be ultimately successful.
There's sort of an analog with the corrections industry as well. We're seeing that here in California with overcrowding. Instead of building more prisons, the state of California, under a federal court order, is moving more and more inmates out of state to facilities in states like Utah, Nevada, and Wyoming, into facilities that are managed by for-profit corrections companies. Again, it's got to be more expensive because you have a fiduciary responsibility to shareholders to create value. I don't get that. Just like I don't get having the health insurance industry having really any part in a national health care program.
But by the way, coming back to that point that Mink made about offering the same coverage that Congress gets.
Yes.
There's a quote from his speech last night, reported in the papers. It said, Obama says, if you have health care, my plan will lower your premiums, adding, if you don't have health care, you'll be able to get the same kind of coverage that members of Congress give themselves.
Right, but again, it's contingent on people being able to afford it. Right?
Correct. Let me, quote from Gwendolyn Mink's blog on the convention one more time. She states, progressives within the Democratic Party used to be for a tax-based, not an employment and premium-based system, much like Medicare. But they've had a change of heart. Now, many in the party are settling for the promise of quote-unquote affordability, which is a promise based on the assumptions that individuals pay for insurance, and they get what they pay for. To back up their choice, to back up its choice is to tinker with the existing system, expanding the public health system to pick up some of the slack, or otherwise making private coverage, quote-unquote, affordable. The platform states that as the health coverage becomes, quote-unquote, more affordable, individuals should purchase insurance and take steps to live healthy lives. And that's page 10 and 11 of the platform. Under the Democratic Party's, quote-unquote, guarantee, not only are individuals expected to bear the burden of health care provision, but they now bear the blame for becoming sick and unhealthy, too. So that's the criticism from the other side. Any comment?
Yeah, I think that there's always a problem with blaming the victim. And, I've argued this with a number of officials who, talk about. There's nothing wrong with, as a physician in the exam room, advocating that patients have to exercise, they have to eat healthier diets, they have to have more fruits and vegetables. It's a whole other thing when you are, say, the Commissioner of Public Health, as we have in Chicago, make that a platform from which you speak in the public arena. Because, now you have people who live in neighborhoods where it's not safe to walk outside at night. Mm-hmm. And they live in these food deserts where there aren't places where they can purchase fresh fruits and vegetables. And, it's part of a much bigger public health issue in terms